Hello and welcome to the ID Talk podcast. My name is Peter Counter and I am the editor-in-chief of FindBiometrics and Mobile ID World. FindBiometrics has placed a featured focus on the healthcare ID market over the past 4 weeks, delving into how strong authentication and ID verification can improve patient ID, electronic health records, and even diagnosis. Meanwhile, here on ID Talk, we are interviewing the leaders in identity technology for healthcare. And that's why today I am pleased to present a conversation with John Ahrens, CEO of Veratad, in conversation with ID Talk's own Susan Stover. Their conversation begins on the topic of patient ID and why it still poses a significant challenge to the healthcare industry. They go on to talk about the various use cases that strong identity solutions can address in healthcare and the considerations that need to be taken into account when protecting patient data, before turning to what healthcare facilities can do today to improve their identity ecosystems. It's a fascinating conversation about a very important identity market, so without further ado, here is FindBiometrics Vice President of Digital Content Susan Stover's interview with John Ahrens, CEO of Veratad, on the ID Talk podcast.
Well, welcome to ID Talk. I'm Susan Stover, VP of Digital Content here at FindBiometrics and Mobile ID World. And today I'm joined by John Ahrens, Chief Executive Officer of Veratad Technologies. Thanks for joining me today, John.
And thanks for having us, Susan. It's a pleasure to be here with you.
So we're in the midst of our Healthcare Biometrics Month, and I wanted to talk to you to start our conversation about best practices for patient identification. So why does inaccurate patient ID remain such a significant challenge for the healthcare industry?
Well, I suppose that's a pretty big question to start. But to start, I'm sure that most of your listeners by now are aware that the healthcare industry has what might be considered a proverbial target on its back, placed there by the bad guys who are after patient identity data for the value it brings on the dark web, and elsewhere where it can be used to wreak havoc on patients and providers and payers. And with the data breaches abounding, the big challenge for the industry is being sure when they're dealing with a patient that the patient is who they say they are. I do hear quite a bit about the challenges in the healthcare industry for improving the efficacy of verifying the patient identity. Some say it's the number of the competing stakeholders, or others about interoperability or the number of things. But from our perspective, it just seems as a bit of slow adoption of new identity verification technologies. We do see the healthcare industry as similar to the other enterprise industries that we provide services to. And when it comes to dealing with identity and data security challenges, there are a lot of similarities. For the healthcare industry, the challenges of patient onboarding, ongoing access to services, point of service interactions, all of these are much like those, for instance, the financial services industry. Okay, and the financial services industry, which is a pretty mature industry at this point for chasing down the issue of their customer identity to prevent fraud and identity theft. And in that industry, the requirement is known as know your customer. And I suppose the parallel here for healthcare would be considered to know your patient. So I think from the standpoint that the delivery of any service has to be built on trust, healthcare and the other enterprise industries we work in are very similar. Now, that said, there are some key differences and specific challenges. And while getting customer information right is important everywhere, healthcare relies more significantly than some of these other industries on critical personal information with respect to data exchange and storage, in that the reliance on accurate data has a life and death component that we don't see, for example, in the financial services or e-commerce enterprise environments. Another challenge I guess we see in the healthcare industry that they're facing, and it's a pretty significant one, is the problem of records matching. And while our solutions are not directly aimed at that challenge, certainly assuring a patient is who they say they are will always be a critical component in addressing that challenge. So healthcare is facing some special challenges that other industries perhaps are not. I mentioned that financial services industry, just for one more example, since if you don't mind me continuing to expand a little bit here, but in financial service, interoperability is ubiquitous. I mean, two parties can transact business with each other over mature and international networks with data transfer and operating rules that are standardized. Healthcare, on the other hand, is faced with these yet unresolved interoperability issues and competing interests that are after the sharing of patient data. So while this seems to be getting a bit more attention in the last year or so, it may be that these challenges have also somewhat slowed the adoption with some in the industry. They're waiting on the sidelines maybe to see what the best solution might be as it appears. So with all the complexity of the challenge, I would say this, there's a lot at stake, and certainly time for the healthcare industry to make getting the patient identity right a priority.
I think that's where we are in terms of identity in healthcare. It is at a critical point. So what are the main obstacles the healthcare industry is coming up against when trying to solve the patient ID problem?
I mentioned earlier that there are a number of challenges or obstacles, and you may have gleaned from my previous comment that we think one of the main obstacles is the slow adoption of new identity verification technologies, right? So that may be due to a number of concerns that the industry might have, not the least of which would be around the implementation of new technologies and the impact they might have, like on things like privacy, data security, patient experience. All of these are important. I do, though, however, see a change coming. And I think there are a number of factors that may have an effect. I mean, I think there's a heightened general awareness, media attention, and everyday conversation at the consumer level around the importance of data privacy and data security. I think people are really starting to pay more attention to what goes on with their data and how the data is shared with people with whom they've shared it. And I think with that growing consumer awareness, there's going to be a growing consumer demand that will push on the industry to do more to demonstrate to them that their personal health data is in good hands. Now, I also believe healthcare providers will want to respond, maybe to differentiate themselves competitively in this regard. And so there'll be a number of important things a provider will need to do in order to establish a consumer-patient confidence. And I think not the least of which will be to adopt an effective digital identity technology strategy as part of their effort. Now, I am sure your listeners know that there are a growing number of healthcare delivery options that are facilitated by the use of new online technologies, such as bots, virtual care, that kind of thing. In order for any of these new methods of delivery to be considered safe and effective, all the stakeholders will want assurances that identity is managed accurately and managed safely. And so I think when you combine the increased consumer demand with a rising number of new healthcare technologies that are going to increase patient engagement, and then you add on into the mix the ongoing need to address the issues of medical ID theft, and I mentioned duplicate records, payment fraud, that kind of thing. The industry's got a significant incentive to innovate new identity technologies, and I think providers are going to be compelled to discover these new technologies for identity and deploy them in a tangible way.
You made some parallels to the financial services industry earlier, which I think is quite interesting, considering I feel like the healthcare industry right now, in terms of adopting digital identity, is where financial services was, say, 6 or 7 years ago. And it really was the consumer demanding something that was convenient but also highly secure. So it'll be interesting to see how healthcare builds the right ID solution. And the term identity is a large umbrella, especially in healthcare. What are different use cases in healthcare that an ID solution can address?
I would say for use cases, maybe the overall objective of the use case in any of the cases you can identify is to properly associate a patient with their electronic record. And of course, that use case is going to include a number of variables with it. I mean, one of them is the point at which you're collecting an identity or looking to prove an identity, whether it's online or in person. But I mean, a couple of examples that come to my mind. And like you mentioned, the financial services out there, I do think there are these parallels. I mean, as I mentioned earlier, but onboarding of new patients in a online environment, ongoing access to services and to the health data, making sure that before you share health data with a third party, especially not present, that you're actually sharing it with someone to whom the information belongs. That's important. So the point of service, I think, like in a virtual world, it's going to be really important in a person not present as more and more the industry moves to the online space. But certainly even in person at the point of service, it's important. But Overall, providers, payers, prescribers for online health information exchanges are in this mix now. Yeah, so the use cases I say are, they're probably more. I'm sure I could maybe think of some others, but those are examples that come to mind. And it's basically to improve the overall quality and efficiency of the patient service for making sure that the hospitals and pharmacies, laboratories, health information exchanges, whichever the point at which the consumer consumes a service, that they actually are protecting the identity and making sure they're doing business with the patient that they should be.
Failing to confirm that your patient is who they say they are can have significant consequences: uncompensated care, claim denials, and worse. Veratad prevents all of that. Veratad solutions are designed to verify an individual's identity while protecting sensitive personal data and promoting a high level of consumer privacy. Companies all over the globe, including some of the world's best-known corporations, trust Veratad to keep them safe. Veratad can build an identity verification solution that works for you. Protect your organization, protect your caregivers, protect your patients. Visit Veratad.com to start talking about how they can keep you safe, secure, and compliant. And now, back to the podcast.
The healthcare space is already highly regulated, but the patient data we've been talking about so far is the most valuable for fraudsters. What considerations must be taken into account after enrollment so that the patient data can be protected?
Well, you're obviously right about the fact that this data is and has been most valuable for the fraudsters. I mean, I think the value on the dark web of a medical record is like some multiple of what you might get for just general PII. So it's really important that you, after you've enrolled a patient or you're actually holding patient information, that information is protected. And I think the focus on that has sort of been there. And it's because I think everyone is really chasing down what might be the holy grail of protecting data at rest, right? So aside from all the good security that's necessary to protect the data at rest from the hacking, including encryption and all of that, I think also the access to the data that's somewhat intentional, right? Like you have a provider that needs to access the data, you have a patient that wants to access the data. I mean, accessing and sharing the patient information, that's a serious consideration. And so aside from the data at rest, it's the access to the data as well.
What are some other key considerations that should be taken into account for facilities looking for the best ID solution to fit their needs?
For best practices, for building the best solution, I mean, the first thing we consider in approaching really any identity verification solution design is to build for a layered approach. You can deploy various solutions based on the risk. I mean, you can include using verification of data, demographic data. I mentioned identity documents, biometrics in a not present environment, device identity, and two-factor. Very important is that layered approach. And I think second, anytime you design an ID solution, you want to take into consideration data privacy, data security. Any solution, these should be high on the list of must-haves. And so in our approach, we basically look for these high-level kinds of things to get started anyway, yeah.
So what is the experience of using Veratad for healthcare professionals and patients?
The experiences vary depending on, I mentioned some use cases earlier. We, for example, have a health information exchange that uses our service. We've got a number of providers that provide an online prescription service. And it's the experience both of the client or our customer, as well as the experience of our client or customer's patient or their customer. Okay, so I mentioned our approach, and we start with a needs analysis. We want to fully understand the use case and the application that we're looking to deliver the service within, and we want to understand the business and the objectives. And then once we have that exercise completed, it's really the flexibility and the variety of our solutions that allow us to deliver a customized, sort of a multifaceted identity verification solution that's specifically designed for the client. So the experience of our users, they're getting the benefit of our approach, which is to offer a suite of tools designed to achieve the desired balance, if you will, of the efficacy of our verification and the cost and the patient-customer experience, all the while protecting the patient privacy. So the experience that they're getting is one where we're delivering a lot of flexibility to our end users. And it's not just the identity verification, it's really the precise identity workflow for, for our customers' experience. So it's very customized, it's very flexible, and the feedback we get from our customers is very positive.
Our podcast listeners know friction is the new F word. The growing burden of compliance requirements and increasing costs associated with fraud are causing new challenges for online businesses and retailers around the globe. But that doesn't mean you have to sacrifice user experience. In e-commerce and retail, banking and healthcare, telecommunications, and more, too much friction leads to abandonment. Veratad makes sure that never happens. Veratad is laser-focused on the user experience. More than just identity verification, Veratad is the precise identity workflow of your application, offering total flexibility so you can stay secure, private, and compliant without annoying your customers. Visit Veratad.com to start talking about how their expertise can keep your operations safe, secure, and compliant. Your users will thank you. And now, back to the podcast.
In terms of a healthcare facility, what can a healthcare facility do today to improve its identity systems?
Yeah. Of course, it's a general
small little question. Yeah.
I mean, it's a general question. I've certainly been I've been known to find the longest way to answer a question, but this one I think I can do in sort of a fairly short order. I mean, at the highest level, I think what facilities need to do and providers need to do is you got to make patient identity a high priority. You have to take the time to evaluate the various options that are available, and improving the system, I think, should be at a very high level aimed at achieving that good balance I mentioned earlier, that just a good balance of security and patient experience and managing the cost. I think you'd be on, at least that'd be the first step, but really the first step is to put a priority on it. And that's something I think that is, as I mentioned earlier too, I think is coming soon.
So talking about, healthcare and moving forward, what opportunities do you expect to emerge for facilities that solve their identity crisis?
Well, in the spirit of my continuance of short answers, I think the short answer is that there are sort of two big opportunities here. I mean, one is to provide a safer patient experience, and with all of the target I mentioned on the back, I think the healthcare industry is going to begin to realize a higher degree of trust. I mean, it's got its data breach issues, and that's data at rest, and I know that there's a lot of focus on that, but it's this getting the patient identity right with the interactions. And when they're, a natural request for data, when, providing insurance claims information, or, whether it's a payer or provider, I think the benefit will be that safer patient experience. And I think they're going to find significant reduced costs. And I think they're going to significantly mitigate, the reputational damage that's going to come over time as these, as I mentioned, the bad guys, I mean, they're after this data, they're looking to use it nefariously. And I think that a greater sense of trust can be built by the industry and the patients it serves when they get this solving their identity crisis, as you put it, squared away. Yeah.
Well, thanks so much for joining me today. I know we had a lot of very big questions, and I really appreciate you breaking it down for us. How can listeners contact you to learn more about what we spoke about today?
Well, thanks so much for asking that. You can easily find us on the web. The name is Veratad.com. The name of the company is Veratad Technology, so it's Veratad.com. And you can look there to connect with us. There are a number of ways there to connect with us through the web. And so that'd be a great way to find us.
Great. Thank you again for joining me. And we're looking forward to continuing to see what Veratad has in store for 2020 and beyond.
Okay, thanks, Susan, so much for this opportunity to speak with you and your listeners.
And so concludes Susan Stover's interview with John Ahrens, CEO of Veratad. To learn more about the topics discussed in this episode, visit veratad.com today. And to learn more about identity and biometrics in healthcare, visit FindBiometrics.com to read our featured articles from Healthcare Biometrics Month. I would like to thank Susan Stover for conducting today's interview. I would like to thank John again for joining us. Our podcast theme music is by Logum Red. I am your host, Peter Counter, thanking you once again for listening to the ID Talk podcast.